see here. Good morning or good afternoon, everyone. Thank you so much. My name is Andy Bruckner. As Lisa had just indicated, I'm the research coordinator with the Florida Keys National Marine Sanctuary. And I really appreciate this opportunity this afternoon to present some of the details of a new best management plan that NOAA is developing in partnership with the state of Florida's Fish and Wildlife Commission. The plan is actually still in its pilot phase, and it's being tested as one tool to mitigate coral diseases within coral nurseries, and then maintain the health of these corals in the nurseries during transport to the reef and when they're initially outplanted on the reef. And in my abstract, there's a lot more information on several other steps we're taking, and so this best management plan that I'm going to talk about today just is one component of a larger effort to address both some of the chronic stressors that are affecting the outplanted corals, as well as when we have acute disturbances such as a hurricane. So I've illustrated 5 steps here that we're taking to ensure the long-term survival of the corals that are being outplanted on the reef. And this begins with pre-outplant care, followed by dedicated maintenance of these outplants, potential mid-course corrections, and adaptive management, which will be something that's based on the lessons that we learned through our monitoring program, as well as emergency response efforts in light of some sort of catastrophic disturbance. And I'm going to just put a plug in for one other talk if you want to hear more information on site preparation and site maintenance. There'll be a talk in the session. It's called Coral Adjacent Outplanting Enhancements that I'll do. It's going to be in Pelican West, and that session starts at 1:15 to 3 o'clock. But what I'm going to focus on today is just a suite of guidelines for nursery care, transport, and outplant management. So as outplant has continued to scale up, the operators had to increase both the number of production nurseries as well as the sizes of these nurseries in order to meet our targets for restoration. And so this has included both a growing number of species of corals, an increasing biomass of these corals, as well as more movement of the corals from the nurseries to the reef and movement of corals from ex situ nurseries into some of these in situ nursery locations. And as a result of all this growth, there's really become a need for more sort of rigorous and consistent practices in order to reduce mortality and prevent the potential for transferring a disease-causing pathogen from the nursery to the reef. And the protocol was really developed largely in response to some large-scale die-offs that we observed during the summer and early fall of last year. These blowouts affected all regions within the Florida Keys, and they resulted in the loss of thousands of corals. There was also some concerns raised that some of the corals that were put out onto the reef that had disease, that there was the potential that that disease actually was transferred from those outplanted corals to some of the wild populations. And so in 2021, we took some initial steps to try to improve practices from the nursery to the reef. But then, unfortunately, in 2022, a month or two ago, we saw some additional blowouts. And in addition to that, this summer in the Florida Keys, we've actually had more severe bleaching and more temperature stress than we observed last year. And we are again seeing an uptick in the amount of disease on both in the nurseries and on the reefs. So the overarching objectives of this best management plan are to ensure that the corals that are reared in the nurseries are healthy and they actually have a lower disease prevalence than those same species that are out on the reefs now. And when you outplant those corals, they do not negatively impact wild corals or previously outplanted corals. The best management plan identifies a series of measures that are standardized and consistent across all operations, and they focus on nursery maintenance, transport of the corals from the nurseries to the reef, an evaluation of the reef before outplanting to ensure that it's safe to outplant, post-outplant examinations of these corals within a few days of outplanting, and then standardized monitoring for each step in the process. This best management plan establishes, as I said, standard practices within the nurseries, and this includes several different steps. One of them is to ensure that these structures are in good shape. They are not falling down into the sand, and the corals that are on them aren't being impacted by that. The structures are largely free of biofouling organisms, and those organisms are not overgrowing any of the corals that are located within these nurseries. And the structures, the corals themselves are kept at a density and biomass such that they are not in direct contact. These three activities alone, we believe, will reduce the likelihood that disease actually emerges in a nursery, and even if it does, the likelihood that it's going to spread from one coral to another or for one tree to another would be much, much lower. In addition, keeping the biomass low on these trees, especially during late summer months, is really critical to reduce the likelihood of damage or loss when there is a storm. And also in the late summer and fall, we tend to have blooms of jellyfish, and there's a lot more floating algae and also marine debris that gets entangled in these trees. And so if you have a lower biomass, you're less likely to have problems with that. So these are just two photos that I took. They're adjacent photos from one nursery that's located off Looe Key, and these particular photographs are from mid-July. When I first went into this nursery at the beginning of July, there was only one coral on the tree, the one that's up in the upper, so the upper left, all the way up at the top, that just had a little bit of mortality. And I came back 2 weeks later, and the disease had spread to other corals on that same tree and also to adjacent trees. So what we're asking for is that for each of these nurseries, routine monitoring would be conducted at least once per month to identify any issues that occur within these nurseries. And so there's sort of two steps to this. One is a very rapid assessment where you swim through the nursery and you identify any trees or structures, it could be any structure that needs any sort of repairs, if there's too much biofouling, as I indicated, and you count the total numbers of trees that have disease to give you an overall percentage of how many trees or structures are affected. The second component of this is looking more closely at those individual trees that have disease to estimate some sort of prevalence. And the standards that we proposed in our interim measures are if there's no disease whatsoever observed in the nursery, it's fine to continue outplanting those corals. However, if 10% of the structures contain one or more diseased corals, you would then not be able to move any corals out of that nursery until you take some sort of corrective actions. If fewer than 10% of the structures have disease, you just can't outplant from any of the structures that contain diseased corals. And then so basically you have to go in and remove the diseased colonies from those corals, and you would go back 7 days later and re-examine those trees that were affected by disease to see if those corrective actions worked. And as long as there's no additional disease that's popped up on those trees, you can then start outplanting from those particular structures again. But if there is more disease, you would then remove it again and follow up with another monitoring event 7 days later. So issues of overcrowding and disease management were actually identified in the Best Practices Manual for Caribbean Acropora Restoration. I think this is one of the first ones that came out of the Caribbean. And it proposes some steps that you can take to try to address this. These are slightly different than what we're doing. I mean, one of the things they recommend is that you isolate your colonies, you can prune the diseased parts of the corals off, and then they also recommended a treatment which just involves placing epoxy directly over the diseased tissue. We're actually recommending that you remove the entire colony from the structure and get it out of the water, and not using this treatment because it's not been shown to be effective in Florida. However, we still encourage additional efforts to try to come up with strategies to mitigate diseases, but this would be taking these corals out of the nursery and quarantining them in an outside location. So the best management plan also then includes specific temperature and bleaching thresholds. And our initial recommendations are that the temperatures within a nursery must be less than 31 degrees Celsius, and you are not allowed to move any corals out of the nursery if they are showing any signs of bleaching. So assuming your corals are healthy and none of the nursery thresholds have been exceeded, you then can move these corals to the reef. In the Florida Keys, there are several very large regional nurseries and a number of smaller nurseries that are located closer to the reef. Because of the large number of corals we want on these reefs, there is a lot of transport of corals too. For instance, there's quite a number of corals that come out of one of the large nurseries that's located in the Upper Keys near Tavernier, and it will be transferred to the Lower Keys and then out to the reef. And one of the things that requires is overnight holding. And so for any transport that involves overnight holding, we are requiring that the water temperatures in those containers that you're keeping the corals never is more than 1 or 2 degrees Celsius higher than what you find in the nursery, and it never exceeds 30 degrees Celsius. We also want the corals to be aerated. We want the amount of coral in each bin to be kept to a small amount. So if you're using small fragments, no more than 30% of that volume would be taken up by the corals, but if they're larger branched corals, up to 70%, and that's mainly when you're moving around in a vehicle or something like that so that they don't bash around and get injured. Before you then outplant, you would look at each one of these buckets and make sure that the water is clear. It's not cloudy in any way, it's not brown in color, there's no mucus or anything like that. When practitioners are transporting corals a shorter distance, something like up to 30 minutes or so, a lot of times that's being done in a semi-moist fashion. They're not submerged in water, and the main issue that we are trying to get everyone to do is to prevent these from any sort of exposure to the sun through shading. So our final criteria is related to the conditions on the reef just prior to outplanting. Anytime that NOAA issues a bleaching alert for a reef, we ask that people go out and assess the temperature 1 day prior to outplanting. And the temperature for outplanting, our initial recommendations are it has to be greater than 21 degrees Celsius and less than 31 degrees Celsius. If it's higher than that, then no outplanting can occur in that location until the temperature declines to less than 31 degrees Celsius for a minimum of a week. So currently our permits require 2 monitoring events, one at 30 days and one at 1 year. And what we are proposing is to add an additional monitoring event that would occur 7 days after outplanting. The main intent of this is that you are able to see then that the corals that you put onto the reef do not die suddenly from something, whether they were unhealthy in the nursery or due to poor transporter handling guidelines. And the monitoring is a very simple thing where for one of these cohorts that you put out, you would go out and count all of the living corals, the ones that are dead or diseased, the ones that are missing, and if more than 10% of a cohort is either dead or it shows active disease signs, then we're asking that all of those corals are actually removed from the reef. And so as we continue to evaluate the effectiveness of these measures, we're seeking more information from other folks that have nurseries throughout the Caribbean. I'm hoping that folks that are conducting some of this work can share some of their feedback on how they've addressed disease in their nurseries, and I've just listed 4 questions here that if you are working with nurseries, especially in the Caribbean, if you can provide us any sort of information on how you ensure your corals are healthy when you outplant and what you do to ensure that they are in good condition when you first put them on the reef. And with that, I will end.